Paws, and today we're going to talk to you a little bit about the basics of splinting. And one of the biggest things that we are emphasizing with this Back to Basics segment on splinting is that you can do it yourself. And in fact, you could probably do it faster than some of the people on your unit. And I don't mean that in the sense that they don't have the experience or the ability, but the fact is that you ask them to do it and the splint may take up to an hour to even be applied when you can easily do it in less than 5 minutes, especially with orthoglass. So in this segment today, we're going to show you how to use orthoglass for a radial gutter splint, which is one of the simplest splints to apply. Depending on if your patient is in pain or if the fracture is complicated and needs more than 2 hands, you may need a partner to hold the hand or wrist steady while you place the splint. And I'm just showing you 2 types of gutter splints here. Basically, one is a little bit soft because we just got it wet and it's just hardening, and this one here is hard and it's already dried. One of the important things to remember is that when you apply orthoglass, it takes about 15 minutes to set. So you're going to have to check your PMS before and after, knowing that it's 100% set and ready and dry before that patient walks out the door. Carlin's going to talk to us a little bit about the application of the splint and the basics. Keep in mind that practice makes perfect for these, and you're going to adapt some of your own special ways of application. Finally, one of the most important things to understand about splinting is the area of the body that's actually broken or in need of the splint itself. So understanding the anatomy and knowing what you're splinting and why, restricting certain movements, so on and so forth, is very important before you apply any splint or cast to a patient. We urge you to take a look at one of the links we've posted for a great article that gives you a short and quick and dirty look at how to splint particular broken bones and which is the appropriate splint for them, because if you use the wrong splint, then the patient's going to have increased pain, difficulty healing, and other problems. So thank you again for joining us, and we hope that you'll join us for the rest of our Back to Basics series on splinting with the procedural pause.
So I'm Carlin, I'm one of the paramedics here. I am splinting the right-sided radial fracture. We're going to measure from the tip of the thumb down to about the elbow. Okay. All right, before we put the splint on, we check PMS, make sure they can feel everything, because we want to make sure that's intact before we put the splint on. Measured, we're going to use our orthoglass. So the big thing is this is the chip clip. It makes sure that the stuff isn't dry on the inside. So we have to make sure that's in place. If that's not in place, you're going to feel that it's really hard, so you'll have to extend where you put your material to measure with. All right, so after that, we cut the length that we need. So this can air dry, but it dries faster and hardens faster if you get it wet. So it's important to put the chip clip back. Like I said, if it isn't there, your material is rock hard. Okay. So I always pull the ends over so we don't have any rough parts on the patient, because these can get really sharp and dig into your patient and create pressure sores. There's multiple versions, but the inside is fiberglass, and it's very sticky residue. So to get it to harden faster, we add water. The warmer the water, the harder the faster it hardens. And this, some versions have padding on both sides like this does. Some only has one side of padding. So the padded side always goes to the patient. All right, so for a normal wrist, we use 3 inches for an adult, 2 inches for a child. This is going to be a little big, but this is what we had. I was like, it comes in 4 and 5 inch sizes also. All right, so we're going to get this wet. You don't need a ton of water, just a little bit. Once it's wet, you're going to wring it out. You want to keep the extra moisture in there because it creates pressure sores. So we've already assessed PMS before putting this on. So because this is going to go on as radius, I make a couple cuts to go around the thumb easier. And it's okay if the splinting material is long, you just don't want it too short. Alright, so I always start distally and go proximally. And you want to cover about half and go half of the length of your ace bandage. So if it's a little long, you just fold it over. Doesn't hurt the patient at all to fold over if it's a little long. And then you secure your splint. And then you verify PMS after putting it in place. So because this is a splint, we don't put cast padding underneath because this doesn't allow for swelling. We have stockinette instead that we can use some of that because that allows for swelling. So the problem with this is it doesn't stretch and it allow for swelling. So we tell patients that if they lose sensation, their fingers start turning blue, going numb, we take to loosen up the ace bandage. So the ace bandage only allows for so much expansion, but it allows for expansion. So they'll take the ace bandage off and they'll still feel numb and blue with this stuff on because this doesn't expand.